want to welcome, we have a lot of people on our head table. We're all getting to know each other up here because the seats are nice and cozy. But I want to welcome everybody this morning for being here bright and early on a Monday morning. My name is Christine Guthrie. I'm the president of the Charles River Rotary Club, and I want to welcome you to this morning's meeting on the response to the opioid crisis in MetroWest. We are honored that you are all here, and we are going to begin today's meeting, just as we begin every Rotary meeting, with the Pledge of Allegiance, which will be led by our Secretary, Hank Rotary.
Good morning. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Though Rotary is a non-religious club, we begin with a non-denominational and inspirational prayer at each meeting, and Gary Hoyt, one of our board members, will be leading us today.
Good morning. We thank you, God, for our daily bread. This food will nourish our physical bodies as we learn, educate, and move forward to act on one of the evils of our society. As Rotarians and community leaders, we look to you for guidance and direction as we look to eradicate the use and loss of lives caused by opiates. We want to do this in cooperation with each other and to serve our towns while following our Rotary four-way test. First, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And lastly, will it be beneficial to all concerned? Bless our coming together while we strive to make a difference. Amen.
Again, my name is Christine Guthrie, and I'm the president of Charles River Rotary, and we are deeply grateful to host everyone today. We are a small, I often say we are a small but mighty Rotary Club made up of men and women that I deeply admire, who include Rotarians who have served for decades throughout MetroWest. They include people in our community, role models in our community, and they're models for the Rotary motto, service above self. Many, like our treasurer Neil Osgood, are veterans who have served our country. Some are members of what is called the greatest generation. One of the many reasons that I admire them is their devotion to addressing the current epidemic of our time, the opioid crisis. Unlike other epidemics, this is an epidemic that has grown in secrecy and shame, and the feeling that it happens to other people. The men and women in my club, and in the many Rotary clubs represented here, and the 2 district governors that are present, do not see this as happening to other people. They see the opioid crisis as a challenge facing our community that we need to address. So I thank all of the Rotarians in the room, especially Charles River Rotary Club, for modeling service and hard work in addressing this issue. At the same time, we Rotarians are smart enough and hopefully humble enough to know that we are not the experts. We are here to serve. We are here to serve the families affected and the first responders who are on the front lines addressing this crisis. Many of those first responders are represented here today. Families, police, boards of health, opioid task forces, medical professionals and leaders. And in order to serve best, we need to ask questions and learn from the people who are the experts in the field, who have so much to share. I want to thank all of the experts who are here today. Their bios are listed in your booklet, which I have to say was made by our intern. I don't know if Ariel is in the room. We have a Natick High School intern who created the booklet with bios, and she largely did it on her own, so I want to thank her for that. So a lot of our honored guests, their bios are in there, and I encourage you to read them. We will be connecting people going forward. Everybody in this room will be connected to each other with your contact information, etc. In addition to our distinguished speakers you will hear from in a moment, I'm excited to present our honored guests. Secretary Daniel Bennett, Executive Office of Public Safety for Massachusetts, Senator Richard Ross, Senator Karen Spilka, Representative Carmen Gentile, Representative Jack Lewis, Representative David Linsky, Martin Cullen, CEO of the MetroWest Health Foundation, Chief James Hicks, Native Police Department, and other police and school resource officers that are in the room. We are lucky to have such distinguished participants today. I also want to thank our sponsors, Coach and Carriage, Needham Bank, Hampton Inn, and Spark Kindness. And to Steve Levy and Century 21 Real Estate for copying the booklets and information for everyone. And again, to our intern, Ariel Franz, for all of her hard work. Our goal today here is simple. We are here as a call to action to support our neighbors, friends, brothers, and sisters as we work to end this opioid epidemic. We met here 6 months ago, many of us, and we're blessed with having 3 police chiefs from Natick, Framingham, and Ashland talk to us about this crisis and about the police response. We heard from families who were affected. Armed with greater knowledge and new connections, we vowed to go out into our community and try to serve and address this issue. Today, we continue that work. Today, we will hear from some new experts and people working on the front lines to save lives. We will hear from our medical community, our boards of health, our Middlesex sheriff, and members of the media. As you hear these speakers and look around the room, it is easy to see our strength among all of these challenges. There are so many different sectors of our MetroWest community that are present here today, and not just sectors, leaders in all of those sectors. Our strength is each other. Just like in the Pledge of Allegiance that we recited at the beginning, we are indivisible. The opioid crisis knows no borders between towns or families. To fight this crisis, we need to break down borders as communities, organizations, families, and people. We need to act as one, and with courage, strategy, and tenacity, we can make a difference. That is why we are here today, and we will follow up with all of you. You can count on it. If Rotary can serve by bringing together all of you amazing organizations who serve, we are honored to do so. Remember, we are indivisible. Our true power comes from bringing all of our A games together and to address this challenge. I want to begin by illustrating this very point about power and progress through connection by introducing our first speaker, Cheryl Lucenta of SOAR Natick. Cheryl is a hero, not only in my eyes, but in the eyes of many people in our community, and a leader of SOAR Natick, which is a Natick-based support group for those with a loved one suffering from substance abuse disorder. So I welcome Cheryl up to the podium.
Thank you, Christine. That really sounds impressive. I don't necessarily feel that way, but thanks so much for hosting this important event and to all of you for being here today. As Christine said, I represent SOAR Natick, which stands for Supporting Outreach and Addiction Recovery in Natick. We got our start nearly 4 years ago as a support group for parents with children suffering from addiction. Through this journey, I've had the privilege of working closely with Natick's Prevention and Outreach Program Manager, Katie Sugarman, Natick Police Chief Hicks and Lieutenant Cara Rossi, Natick Director of Public Health, Jim White, and many others from our community. Christine Guthrie and Spark Kindness deserve a special recognition for their constant encouragement, partnership, and support. Without these people, almost none of what has happened in Natick would be possible. I guess you could say I've become the face of a family dealing with addiction in our community, but it took a long time to get here. Early on, my family was in complete denial about what we were seeing, thinking suggestions made by professionals were overreactions. After all, a lot of teens experiment, and they're absolutely fine, right? It's a rite of passage, isn't it? We were sure my son would outgrow these behaviors. We were so wrong, Then when we eventually realized our son really needed help, we had no idea what to do. I tried searching online and came up with advertisements for places like Passages of Malibu, which I guessed would exceed the almost non-existent budget that we had for this. After a lot of trial, errors, and relapse, we learned that all we could do was support our son and let him own the recovery part. And own it he did, completing 5 years in recovery in December.
Wow, congratulations.
Thank you, I wish he was here to hear that. The worry does subside over time, but it never completely goes away, and it truly is a one-day-at-a-time process for the whole family, too. In September, I was given the opportunity to speak here and suggest ways that some of you could help with the opioid crisis. A lot has happened since then. One of my requests on that day was for help forming SOAR Natick as a nonprofit. At the end of that meeting, I was approached by a couple of individuals in attendance. Ultimately, it was a connection made by Natick Selectman Mike Hickey, thank you, Mike, that introduced us to the prestigious Boston law firm Brown Rudnick. They accepted us into a program that offers no-cost assistance to select nonprofit groups. By the end of 2017, we were officially a nonprofit corporation in Massachusetts and are now in the process of filing our application for 501c3 status with the IRS. Thanks to the work done by Brown Rudnick, SOAR was able to accept a large grant at the end of 2017 from the Reddish Foundation. The Reddish Foundation is a family charitable giving organization, and one of their family members and dear friends of mine lost their son to opioid overdose in September. Through this grant, they're showing their appreciation for the work that we do to help others. In December, our Rotary groups and others in the community contributed to our Giving Bags drive. We were able to assemble approximately 40 gift bags filled with necessities and deliver them to 2 recovery homes in the local area during the holiday season. The gratitude they showed for these gifts brought tears to my eyes. We received hugs of appreciation as we left, followed by handmade thank you cards. We decided to continue our support and put some gift bags together for Easter, and these were delivered to a local recovery home for young men. Here are a couple of comments we received through a counselor that works with them. One young man said, "It's nice to know that strangers care about seeing them succeed and don't just look at them as addicts and junkies." Another said he had not had anything given to him for Easter in years. And another said, "It was nice to see that parents care and that some have the opportunity to rebuild relationships." I share these comments with you not to pat ourselves on the back for doing something nice, but instead to open your eyes to the damage we've done to the self-esteem of those suffering from addiction. Friends and families that don't understand the disease, poor handling during crisis moments by medical professionals, law enforcement, and our court system have gotten us here. The great news is that most of the folks in this room already recognize this and have begun to change their approach. These are steps in the right direction that we need to continue to improve. In January, we hosted former NBA star Chris Herron, who spoke to a full auditorium at Natick High School, nearly 800 people, to share his story of addiction and recovery. Then in March, we were pleased to co-sponsor Dr. Ruth Pote, who helps us understand what happens in the brain when someone uses substances and how this can lead to addiction. We've partnered with the Natick Opioid Task Force to host well-attended monthly workshops covering a variety of topics related to addiction, along with access to resources. In June, we'll be assisting a family that lost their son with a hike in his memory. And it was wonderful to have Natick Rotary host their February Flurry event and raise funds to help. In spite of all the great work being done, though, we're still losing an unimaginable number of lives to overdose. So while I'm so appreciative you're all here today, simply attending this meeting isn't enough. There's a lot you can do. Please take the time to educate yourselves and understand addiction. Take advantage of the new Narcan program that our communities are offering. And I've asked this one before, Create recovery-friendly workplaces with particular emphasis on job opportunities for those at different stages of recovery. Recognize that many individuals in recovery are presented with many challenges when searching for jobs. There are so many ways we can work together to make things better for those suffering from addiction in our communities. Stigma is one of the biggest hurdles we face in moving things forward. It's wonderful to see how many of you want to make a difference. Thanks for making this a priority.
Good morning, my name is John Featherston. I am the former president of Charles River Rotary, and I just want to give out a shout out to my new president, Christine. This is a wonderful event, and thank you, Christine, for doing all of this. It is with great honor that I introduce our next guest, a man who I consider a friend. And years ago, when I was a selectman in Ashland, I picked up the phone and said I had a problem, and his response was, when and where and what can I do to help? And it's so refreshing when you get a public official with that type of attitude. And our next guest, Sheriff Peter Katuzia, is that guy. He gets it. He's one of the few guys that I've run into in my political career that he's always got a can-do attitude. And we're here today to invite him, because years ago, I reached out to him about the opiate crisis, and I was impressed by what he looked at, I will say, before this unfortunately became a mainstream item. And he was on the ground, the boots were on the ground today, and the sheriff is now going to speak to kind of frame the opiate crisis from the police and sheriff perspective. And with that, Peter Katuzia.
Good morning. It is great to be with you here today, and to Madam President, congratulations. Wonderful job up there. To John Featherston, I do have a deep and abiding friendship and relationship with John, which just goes to show you can actually have a real Republican and a real Democrat that can go to do good things together, right? When you speak with John, you find that you have a lot more in common than you think. So, John, thank you for your leadership, and thank you for bringing me out, in the past, and I look forward to coming back on your show as well. I want to say thank you very much. I know we've got Chief Hicks here. We've got Representative Linsky is here, thank you. Representative Gentile, former colleagues of mine. Actually, David and I go back to the DA's office back into the early 1990s, actually, David. Yeah, a long time ago. So funny when you get to the age where you say, I've known someone professionally for 25, coming up on 30 years. It just makes things very different for you. I also want to, recognize Secretary Bennett. Secretary Bennett and I have been working, we had meetings with our staffs just on Thursday and Friday. The Criminal Justice Reform Bill is coming up, which has a lot of great promise in it. The Secretary has been working with the Governor's staff and with the Commissioner of Corrections in order to enhance and make this bill even better. So I really appreciate it. And literally our staffs were working, not figuratively, but literally all weekend long in communication, which is something you really don't hear about much about your government in action. All weekend long, my staff was calling me, which was annoying me, but it showed me how hard they were working, right? I'm sure he was also getting annoyed by his staff because we're having to make decisions throughout the weekend. We're really looking forward to making something special happen. I want to thank each one of you for participating and coming during this early morning as well. Now, it may be that I have to leave at some point a little bit before this event ends. I am a featured speaker at the National Alliance for the Mentally Ill, the NAMI conference that's going on at the State House. I want you to think about that, by the way. To me, it doesn't sound that unusual because of who I am and with whom I served, but for when you think about the fact that they have a sheriff as a featured speaker at an event sponsored by the National Alliance for the Mentally Ill, really tells you something about what's going on in our world, but really what we're doing in corrections as well. And I'll speak about that in a moment. Let me run a few numbers by you. 49, the number of opioid-related deaths in Ashland, Framingham, Natick, Sudbury, and Wellesley between 2015 and 2016. 758, the number of opioid-related deaths in Middlesex County between 2015 and 16. 2,116, the number of opioid-related deaths in Middlesex County between 2005 and 16. 2,155, the estimated number of opioid-related deaths in Massachusetts in 2016. 13,870 the number of opioid-related deaths in Massachusetts between 2000 and 2016. Let's think about those numbers. Many of you might remember, and I think David was around in 2005 when I led the commission to study OxyContin and prescription drug abuse, and how it became a step, more than just a gateway to heroin addiction, but really almost a rocket booster to heroin addiction. When I led that commission back in 2005, we had 525 deaths as a result of overdose, opioid-related overdose. In 2016, we had about 2,155 in only 10 years, 11 years. What's even sadder is that we knew very much, those of us that have been involved in this world know very much the same information that we knew then, right now. The information hasn't really changed. One thing that has changed is the advent of fentanyl. So to Cheryl, thank you very much, and God bless you, man, because your son, you know, those are the ones that we hold out to show that there is hope, that there is light at the end of this terrible and long and dark tunnel. Those are the things that inspire us to keep going, because sometimes if you know someone that suffered from this type of addiction, you feel like there's no hope. And yet you can find people that have succeeded in this fight. These 13,870 deaths from 0 to 16 are fathers and sons, their mothers and daughters, brothers and sisters, their cousins, their neighbors, who lost their lives to the devastating disease of addiction. And let's remember, addiction is not a criminality itself, it is a disease. Those numbers don't even begin to capture the stories of those who are still living and struggling with addiction every day, with those parents and children left behind, or those trying with all their might to save the life of a friend. What's also concerning, we should be aware of, is that in Middlesex, I'll speak a little bit about this. Well, I'll speak about that in just a moment. The crisis we have, this crisis knows no boundaries, you know this. From the poorer neighborhoods to the wealthier neighborhoods, from the cities to the suburbs, from communities. Armenian American community likes to think that it is immune from the frailties of other society because of our rich ties to each other and to the church, and yet we are affected by this just as much. From those that struggle to maintain a roof above their head to those that have a beautiful big home over their head. Addiction is a disease that doesn't discriminate. I'd ask you if you could just raise your hand if you know someone that you have lost to addiction. Raise your hand. My God, that's a lot of hands up there. How many people raise your hand if you know someone that has struggled with addiction? Even more. How many of those that know someone that has struggled with mental health issues? How about raise your hand if you know someone that has become incarcerated because of some of these issues, right? I mean, you are successful business people. You are successful members of this community, and yet almost every hand was raised for at least all of those categories. That shows you how we are affected today. At the Middlesex Sheriff's Office, we sit at the intersection between public safety and public health. Truly, public health is public safety. 42 to 43% of those that enter my facility for the first time have to be medically detoxed for drug or alcohol problems, right? Almost half have to be medically detoxed because they are high, or they are drunk, or they're in such a state that they are going to go through deep withdrawal. That's over 2,000 men we had to medically detox using best medical practices last year. Almost 50% of those that entered my facility have a history of mental health. These are consistent with any numbers you hear across the state and completely across this country as well. We will not and we cannot arrest and incarcerate our way out of this crisis, and I think your law enforcement in this area knows this. That's why diversion and intervention programs being run at the local level are so critically important. Before I talked about some of those local programs, we have one medication-assisted treatment and directed opioid recovery, the MADDOR program. It's a 6 month post-release, so it's not inside, it's post-release, using Vivitrol, the injectable form of naltrexone. We have assigned navigators that then, by the way, this is an idea that I got from the State House from my healthcare days, when I used to work with Marty too. And quite honestly, the numbers have been pretty darn good, especially when you consider the reduction in recidivism. We have a navigator that stays with them. We then set them up with appointments with their medical community, with their medical providers in the community and clinical supporters in the community. We've built a network of more than 50 community health providers spread over 100 locations across the state into areas where our participants are returning to. For this initiative, the National Institute of Corrections has designated us as a center of innovation. We've been asked to travel to Maine, to Ohio, to Florida, to we're going to Louisiana pretty soon to share the work that we're doing in this. It's a pretty interesting program. We're also very careful. We collect our data so we can report our data. We're very transparent about it. And the model seems to be working, which is really exciting. We've also hosted people coming in from Nevada and Arizona. We've got a few others coming in as well to take a look at this and other programs. Through the more than 2 years, we've seen promising results in both harm reduction and recidivism. When we deal with addiction, we always have to be thinking, what is the goal of what we try to do with drug addiction? Is it to get someone clean and sober? Is it to stop them from dying? This is a goal that we as a community have to think about too, right? We don't like to think, is it just to stop them from dying? We'd like to think it's to stop them from being addicted. But in the end, you've got to go step by step. Our data shows that in more than 2 years, a running total of 2 years, 76% of our participants have had no recidivism, and of those that have successfully completed the program, 81% have had no recidivism. Those are pretty remarkable numbers. They could be better. They always should be better. But if they were that much better, I probably wouldn't be telling you the truth, right? There's only so much you can do. And I hate the people that get up there and say we have, 1% recidivism, because I just know that they're not telling the truth, right? Of the almost 350 unique individuals who have participated, sadly, 5 have succumbed to an overdose death. But when you consider that those that are recently released from places of incarceration have a death rate of 120 times higher than those recently released than those in the general public, those results are pretty remarkable. When you consider that a Rhode Island study did a study on those on medication-assisted treatment in their state, those numbers were even higher than ours. We're pretty proud of that. Now let me just say this, we're doing other programs with MIT and Advocates Inc. in this area. For those that are coming out with mental health issues, we're assigning navigators to help them get back into the community. We're working with the Arnold Foundation on a data-driven justice initiative that a number of your departments and Chief Hicks is involved in as well. We're doing a lot. We've got the first young adult offender program in the entire country being done with the Vera Institute right now in Middlesex. We're doing some really amazing things. I couldn't be prouder of the program that we're running. Young adult offenders, 18 through 25, by the way. Higher rates of, well, we all know, right? Any of you guys have sons? Mine's only 14, but I can already see what's coming, right? Later maturation, later frontal lobe development, riskier choices, failure to understand the consequences, much higher rates of recidivism. Now, I'm proud of the programs we're running. I could crow about them all day long. I couldn't speak highly enough of the program we're running out of Middlesex, but across in corrections. But I want to say this, you shouldn't have to come to jail to get good programming. All right? For some people, it might be what people need, but we should be getting this programming out to them before they come in. There's so many local initiatives. One here in Natick, the Natick Opioid Task Force, which a number of you are involved in, bringing local officials, first responders, and service providers together. Lowell has a community opiate outreach program. Police and fire outreach workers partnering to knock doors of recent overdose victims to help them detox and recovery opportunities in Arlington. Opiate Outreach Initiative, clinicians conducting direct outreach to known substance abusers, users. And of course, Chief Craig Davis that started the first the forerunner co-responder model, which with Advocates Inc., which has shown so much promise and really has become a national model, by the way. Should be very proud of the work being done here. We also have to consider the high rates of co-occurrence, those with mental health issues. In our shop, about 74 to 76% rates of also substance use disorder too. How do you extricate those two? But they're usually tied in together for so many of this population. These initiatives also show the recognition that no one person or sector will solve this problem by themselves. You need the work of public safety, government at all levels, medical community, faith community, educators, families, nonprofits, and importantly, the business community. As I always say, good business and good community are not mutually exclusive endeavors, right? And by the way, in my local communities, every charitable event that I go to is filled with a business community. So thank you for what you do. As I close out, I want to briefly touch back to 2017. I'm sure many of you noticed the numbers I offered were 2016. Last fall, Chief Hicks stood before you and talked about some of the positive data coming regarding the first half of 2017, but he cautioned that some of the indicators were not as positive for the third quarter. We have near complete data for 2017. The numbers now show that while we did not see the estimated number of opioid-related deaths fall below the 2,000 last year, they have gotten slightly better. We have bent the curve. Now again, we should not rejoice about this, but we should feel some satisfaction of what some of the stuff we are doing is working, and then to redouble our efforts. Because in just bending the curve slightly downward, that is a major endeavor when you think about that freight train running at you to slow it down, to slow it down, to slow it down, then stop it and then push it back just slightly is a major accomplishment that is not done without your help. This is a sign that we should continue to keep our foot on the gas. We need more community-based treatment resources for those with substance use disorder. We need to remain focused on the still growing threat of fentanyl and carfentanil, which is the major driver of our overdose deaths right now. It's now being mixed with cocaine. It's now being imprinted into pills that people think are taking Percocets or Vicodins illegally, but they're actually taking fentanyl. I think that the last number I saw was about 60% of the overdose deaths had fentanyl in their system. And one last thing that I do want to draw out that I will say. I said before, you shouldn't have to come to jail to get good programming. We as a society and we in government have to understand that these individuals that become incarcerated, I consider them to be canaries in the coal mine. Those frailties and those ailments of society manifest themselves in a smaller, more frail population for a number of reasons, population that then become incarcerated. And we as a society have a greater responsibility, not just to look at the programming we're doing in jails, or to send people to jail, or to say we're going to change the way we do things in jail, but to stop people from coming to jail. And by the way, when we speak about diversion, it's not just diversion. I'm sorry, I'm getting a little excited here now. It's not just diversion away from jail or from arrest. It's diversion into the treatment that they need. And by the way, when people get out, let's support them on the way out. If you notice, a few of the programs that we're running out of the Middlesex Sheriff's Office are programs that have supports on the outside. That's not our job. It's not our role. Much like what Chief Hicks is doing and so many police chiefs are doing in changing the way we're dealing with these crises before us, these are steps we're having to undertake. It is not the traditional role. Statutorily, it is not my role, but we need to do something to stop people from coming in, and we need to do something to support people when they get back out so they don't have to come in. If we don't do that, we can run the best programs in the world, but we're never going to stop this crisis. So I say thank you, because you in this room are part of what will make that change. You in this room will allow our society to understand that we, as an entire society, can't just point at police and can't just point at corrections. We as a society need to step up and demand more and provide more. I see no shortage of that here. And I ask you to continue to use the initiative that you have shown, the drive and the passion that you have shown, the caring and the empathy that you have shown, and to spread that further, not just through the business community, but through all communities. because it's going to take a community-wide effort to stop this problem. Thank you very much.
We here at the Charles River Rotary are excited about our next guest as well, too, because media plays a huge role in the opiate crisis. Good, bad, or indifferent, it's part of our lives now. And kudos to WCVB, that's not easy to say, 8 o'clock in the morning, WCVB, Channel 5. They've been an industry leader on the opiate crisis, and they've done a lot of great pieces on that as well. So it's an honor to introduce David Probert from WCVB. He's going to talk to you about the media's role in the opiate crisis. Good morning, David.
Good morning, everybody. Thank you for having us here, and I want to thank everybody here for putting a focus on the opioid crisis, a crisis that really only began to go public and go mainstream, it seems, a few years ago. There's a lot of misconception and stigma surrounding opioid addiction, who the users are, who their families are, where they come from, how they became addicted, and their struggles to find lasting recovery. There's no doubt that the stigma has been one of the significant barriers preventing people from getting help. WCVB has always been committed to serve this market as Boston's news and community leader. And part of that commitment is tackling topics that reflect what our viewers are experiencing and telling stories that expose problems and help find solutions. But it isn't until a topic hits close to home that it starts to move from the abstract to the painfully real. The opioid crisis, overdoses, the struggle with addiction all began hitting close to home for us in 2015. First, we started seeing more rescue calls for overdoses, something the news media typically does not report and you're not going to see when you turn on the television at night. We saw more viewers coming to us, emailing, calling, parents frustrated, they had nowhere to go, they didn't know how to help their children. We then had the realization that some of our own colleagues and our neighbors had family members and friends struggling with opioid addiction. These users and their loved ones were often fighting the battle in the shadows. Many were ashamed of what was going on, and all of that was contributing to the problem. We knew something needed to be done, but what can the media do? Well, we have a powerful voice and the ability to educate viewers and impact change legislatively and socially. Making the decision to take on a social issue like drug addiction is not always a risk that some media outlets are willing to take. Yes, I said a risk. It truly is. Maybe it's the stigma. Maybe viewers won't feel that it impacts them. It's possible that regularly reporting on an issue like this could turn people away. Drawing on our commitment to serve our viewers and communities, we decided to take a stand. WCVB embarked on a full day of coverage focused on the opioid crisis in June 2015. We included stories in every newscast, produced an entire chronicle program on addiction, and offered an online chat with recovery experts who could offer resources to those who reached out. The goal was simply to raise awareness, expose some of the roadblocks to treatment and recovery, and get a conversation started, one that could bring the crisis more public and encourage solutions. We also made a commitment to continue our coverage for at least the next few months. I was one of the people responsible with directly overseeing our coverage, and the response we received was truly overwhelming. It really was. It's still overwhelming. Families contacted us and told us that for the first time, they felt like this wasn't their battle to fight alone. They felt empowered to tell their stories, and they knew that sharing their experiences could actually help somebody else. These were your neighbors, your friends, and we all knew that their stories and their experience and struggles would provide the real impact for change. It seemed like what we were starting to do was the right thing, and people were not turning away. Our commitment of a few months of coverage soon extended to a full year of coverage. At that point, WCVB had aired more than 100 stories focused on the opioid crisis. We partnered with the state on the State Without Stigma program, and we kept moving forward. At the same time, and I'd like to think that we helped put some pressure on everybody, lawmakers were moving forward as well with different initiatives to assist in treatment and recovery. This wasn't, and it isn't, just a Massachusetts problem or a New England problem. Soon, nationally, the opioid crisis was a headline. This was something that wasn't ignored anymore, it couldn't be ignored, and the media was starting to take notice across the country. By the start of 2017, our sister stations in New England and in the southern part of the country were aggressively reporting on the crisis. Our parent company, Hearst Television, made a public commitment to expand the efforts to educate the public and destigmatize addiction. In 2017, all 27 of our television stations across the country began a year-long campaign. You've probably seen it, it's called State of Addiction. At the end of 2017, in that 1 year, WCVB and other Hearst stations had produced more than 2,000 unique stories, 30 local television specials, a national primetime special, Facebook Lives reaching millions of people, and web content reaching millions more. A lot of it resources and suggestions on places to turn for help. We partnered with the DEA on their 2 national drug take-back days, increasing the number of prescription drugs returned year over year. But the most powerful work that we did, or I think anyone else in the media did, was in-depth storytelling, bringing a face to the individuals and their families who struggle with addiction every day. They let us into their homes, they trusted us, and they opened up their lives. And showing their stories led to other people being willing to open up. And pretty soon there was a dialogue going in every corner of the country. So what can the media do to help in this crisis? Simply make a commitment and try to make a difference. Offer resources and support. Think about language and video. These are substance users, not abusers, not addicts. It's the same thing any of us here can do. Open your eyes to what your friends and neighbors are going through and try to make the situation better for them and others. Offer support, offer to talk to them, find out what's really going on. Hearst Television is just one company, WCVB is just one station. We know that significant work still needs to be done. Last year, we lost as many as 2,000 people still in Massachusetts to this crisis. But it seems the stigma is starting to fade just a little bit. People are talking about opioid addiction in meetings like this, talking about it not in hushed tones anymore, but in loud voices. And our commitment to humanize the crisis, eliminate stigma, and develop solutions continues today. If one life was saved by something we can do, or something you can do, one family was spared the heartache of losing a loved one, it's all worth it, right? So please be a friend to your neighbors, to your community, and talk to them about what's going on and work to find solutions. Thank you.
Thank you, David, and thank you, WCVB. I mean, I think one thing we're going to be doing going forward, like I said, is connecting everybody virtually. Everybody in this room will be letting you know everybody's contact information, but we're also going to be sending around resources. WCVB's website has all of those things that were just referenced, all of the stories, the personal stories, the state of addiction in Massachusetts, and it's very impressive. I think what we can all do to keep that going, to keep telling the story, is give positive feedback and watch WCVB and other stations that are telling stories about the opioid crisis. So for the next part of our program, we are going to be focusing on the medical response to the opioid crisis. I want to introduce a keynote speaker, Jeffrey Liebman, the CEO of the MetroWest Medical Center. I want to thank him for generously coming here today to talk to us. Mr. Liebman joined the MetroWest Medical Center as CEO in September of 2017. So it wasn't that long ago, and for him to be here already, speaking to us and speaking to the whole community, I think is very impressive, and I'm very grateful. Previously, Mr. Liebman was the president of the Good Samaritan Medical Center in Brockton, CEO and president of Beth Israel Deaconess Hospital in Needham, and executive vice president and COO of St. Luke's Hospital in New Bedford. I think that his participation today and that of MetroWest Medical Center is very significant. We all do, and we are so glad that they're part of this MetroWest community of partners addressing the opioid crisis. I know they've also been participating in the Native Opioid Task Force as well. So I'd like to welcome Mr. Liebman.
Good morning.
Good morning.
You know, before I begin, I want to thank the Rotarians in the room. Being a former Rotary member, you do wonderful work. It's great work, and I really do appreciate what you do. I will admit, I was a Rotary member in Needham. Don't hold that against me. But I've also been a Rotary member in places like Memphis, Tennessee, and other places. So the work you do really cannot be replaced by institutions such as mine. It really is a volunteer effort that's incredibly effective. So thank you all for what you do. I really appreciate it. So they gave me 10 minutes to talk about a small problem. And let me first say that this is not a problem that we can solve ourselves being the healthcare community. This is a very difficult, challenging problem. You know, I've lived here about 30 years now. I grew up, in fact, my neighbor was just telling me I've done remarkably well for such a newcomer. But I grew up in an area in New York City, one of those that has not yet gentrified again, which tells you what kind of neighborhood it was when I lived there. You know, we have a challenge here because this is a problem that cuts across outpatient activities, inpatient activities, community resources, state funding, everything that you can imagine is going to have to be thrown at this problem to sort of fix it. You're very lucky in this region, though, because I will tell you that your state delegation, Senator Spilka, Representative Gentili, Representative Lewis, Representative Linsky, they have all been incredibly supportive of our efforts to try to make things go well at MetroWest Medical Center. The resources we've put to this problem are extensive. We have 86 mental health beds dedicated to mental health issues. I believe that is the largest commitment of any acute care hospital, I believe, in the whole state right now. We will continue to do that as long as we continue to be able to afford it financially. And in there, let me give you an example of what we see as inpatients related to opioid crisis. So when I grew up, the opioid crisis was pretty defined to a particular aspect of the society. The three typical patients we see on an inpatient side now is the middle-aged woman who happens to live in the area, the high school student, the innocent high school student who was introduced to some stuff that he didn't realize was going to lead to this, and also, believe it or not, the weekend warrior. So all us guys in the room, we think we can play basketball till age 80, and then we get hurt, we start taking stuff to take the pain away. It leads to other consequences. That's what we see on an inpatient basis. We do not see kids in the back alley necessarily, or filling our beds who are shooting up heroin. That is a problem, but it's not the only problem, and that's what I want to leave you with today. We also obviously have a very busy emergency room on 2 campuses, in Natick and in Framingham. We have about 65,000 emergency room visits this year. A good portion of those are dedicated to the opioid situation. So let me step back and give you sort of the larger picture from a healthcare perspective. 78 people die every day from overdose use. And every 3 minutes, a woman walks into an emergency room looking for relief because she's gone there for abusing or misusing painkillers. 20 to 30% of those people who have been given an opioid prescription will misuse that prescription. 8 to 12% will develop what we call opioid disorders, significant disorders. 4 to 6% will eventually become heroin addicts. So let me now take it down from the 35,000 foot level to make it home a little bit. We see about 2,000 people a year that misuse opioids, 800 that become long-lasting disorder problems, and about 400 people that convert to heroin each year, just at our little hospital. Our activities have been drilled down to 3 or 4 specific areas. The first is prevention. We believe that if we can reduce the opioid prescription being written on our campus, that we've done something significant. So we have a major task force to reduce or limit the amount of opioids we prescribe upon discharge. We also try to identify those people in the outpatient or inpatient setting, and before they leave us, to move them to the appropriate support group. You're very fortunate you have a lot of support groups here. Some of those are supported by Marty Cohn and the MetroWest Health Foundation. Others have means on their own. But without those support groups, this would be a much more daunting challenge. We also try to work with our medical staff to reduce their prescribing habits. Doc, I have 2 daughters. I tell everyone I'm very fortunate. They both smarter than their father and look like their mother. But one is a first-year medical resident at UMass Worcester. And for the very first time, they're starting to introduce them, I believe, in a meaningful way towards what the problem is and try to teach them what to do about it. A lot more needs to be done, but as an example, we have to also train the physicians appropriately before they leave training. Once they leave training, they get very, very busy and they fall back on old habits. So we've worked with our medical staff to establish new guidelines as to how we're going to treat people. We also, believe it or not, compare individual prescribing patterns amongst all our physicians. Emergency room, inpatient, all over. And because of that, the number of opioid prescriptions written upon leaving our hospital has fallen by 60%. So we have seen significant progress there. We also believe that the only way to tackle this is through community partnerships. We have a number of task forces. Chief Hicks is kind of tired of seeing me, I think. But we try to get around and talk to a lot of people. We have dedicated most members of the senior management team, my direct reports, to volunteer or participate in at least one community group to try to work towards solving this. So our new protocol is to engage as many community resources as possible. We also are trying to develop a program we can enroll patients in what we call multidisciplinary programs. So we have a certain number of people who come back with this problem that we call affectionately frequent flyers. They come back consistently. We have one person who has come back 10 times in the last 2 weeks. Because of other laws and regulations, things especially known as HIPAA, things like that, we have to get their permission to allow us to put them in protocols so they're identified when they come to the emergency room or as an inpatient, and then they can automatically be sent to the appropriate community support group. So I want to close by saying that we are here to serve the community and help. If there are any of you that have any ideas or any ways that we can come up and work even more collaboratively, we greatly appreciate those. Thank you very much.
Thank you again, Mr. Liebman. I think that hearing about the specific things that the hospital is doing to address this opioid crisis, it's just really helpful and meaningful, and also all the numbers that you presented. And we're really grateful for your community partnership. I know I speak on behalf of a lot of the organizations that are here. I also wanted to recognize, actually, our district governor, Karen Gaffney. There are a lot of people who've come in and sat in the back, which I totally appreciate. There is a seat for you up here at the head table. You don't have to come up if you don't, but I want to recognize our district governor. As Mr. Liebman mentioned, Rotary, not only Charles River Rotary, but Rotary clubs throughout MetroWest have been working together and are trying to amplify our efforts so that we can really address this crisis together. A lot of volunteers who are putting service above self. I also want to recognize District Governor David Gardner, who is here as well. You can see on a resource table that's outside their district, which is Greater Boston North Shore, put together this great booklet resource that has all of the organizations in their district working on this issue. This could be something we put together for MetroWest virtually or not, so we can all connect with each other, so I wanted to recognize that. I also wanted to, a few people have mentioned Marty Cohen, the CEO of the MetroWest Health Foundation. The MetroWest Health Foundation is behind a lot of the great things you're going to be hearing about today, has funded a number of them, including what we're about to talk about. I want to invite next, and Martin Cohen is here, right there. I next want to introduce Jim White, who's the director of our health department in Natick. And he and a few of our next speakers are going to be talking about a really innovative program in MetroWest, in the communities of Natick, Framingham, and Ashland. Is that? Yeah, okay. And Hudson. To make Narcan more accessible to the community. And I want to also let you know that as you're following along, the folders that you received today have these statistics, this handout. These are brand new from the CDC. This What Can You Do? It's from March 2018. And there's also the next page has, you'll see beautiful Kelly Joseph's face on. There's an article in there about what we'll be talking about. It's been in the news as well. In addition to that, there is a document called What Can I Do? There's actually 2 sheets. These are documents that have been created by our honored guests, just so that when people leave the room today, that question of what can I do, we've got some answers for you, and they are answers from experts, not from us Rotary people just guessing what would be helpful. And we're going to touch on that as well. But right now I want to introduce Jim White from Native Board of Health.
Thank you, Christine. It's my pleasure to be here today to speak to you regarding this challenging topic of the opiate addiction epidemic. Sorry, mouthful. The purpose behind all public health initiatives and the role of public health officials are to provide means of prevention, harm reduction, and minimizing risk factors. So when I first got heavily involved with this crisis about 2 years ago, I began thinking, what can I do from a local public health standpoint to aid families that are struggling with this disease and to help ease the stigma and the feeling that they were alone in this fight. Started giving thought about resources the health department could offer. The availability of naloxone, or as we call it, Narcan, came up several conversations between Katie Sugarman and myself. So the research on how that could be accomplished began. But my real aha moment came when, probably unbeknownst to her, Cheryl Lucenta conducted her own mini survey around the local pharmacies to see which ones were offering over-the-counter Narcan, to compare prices, to see how her request was received. The prices varied. Some of them were as high as $140 a dose. The face-to-face encounter ranged from professional to others that seemed cold and judgmental. When that information for this life-saving medication was passed on during an opiate task force meeting in Natick, my decision was made. The original thought was to offer free Narcan, dispensed through the Natick Health Department to family members who had a loved one fighting this disease, in a completely judge-free setting while protecting their privacy. But during one of our MOPSI strategic planning meetings, and I'll let Kelly discuss MOPSI in depth, she's going to be the next speaker, I mentioned Natick's intentions of distributing Narcan to the public. The plan changed. It was decided that all 4 local health departments, and as Christine mentioned, Natick, Framingham, Ashland, and Hudson, would kick out this Narcan distribution initiative together. Also, that initiative would be expanded to include training and dispensing Narcan to businesses and local hotspots where overdoses may be more likely to occur, and to persons working either in areas of high risk or with individuals at high risk. The 4 communities working together offer an opportunity for a much wider distribution. The collaborative would like to see additional communities follow our lead, as this epidemic, as has been stated, has no borders. Distribution to the public began on March 1st. And today, Natick has trained and dispensed Narcan kits to 8 individuals on a one-to-one basis, with the public libraries being identified as a location of potential overdoses. Katie Sugarman and Leela Mercer, my Natick public health nurse, provided a pilot training session for 20 employees of the Natick Morse Library. Following the training, 4 Narcan kits were provided for the library, 1 for each of the 3 floors, and 1 for the bookmobile. The library has since requested additional follow-up training for the remaining employees. The Natick Recreational Department also has requested training, and that's training is scheduled, date to be determined. I'd like to take this opportunity, first of all, to thank the MetroWest Health Foundation and Marty Cohen for the generous grant that allowed us to purchase and package 500 Narcan kits for the 4 communities. And we have samples up here so you can see what they are. Also like to take this opportunity to thank Izzy Rivera and JRI, the Justice Resource Institute of Framingham, They provided training for trainer for the 4 communities, enabled us first to dispense and apply the Narcan. So in closing, I'd like to say, to us, the 4 communities, this effort has been bittersweet. We are proud of the fact that we are the first 4 local public health departments in the state to provide Narcan, but we wish there wasn't a need. And as we know, this is not a cure-all, but a frontline means of defense in an effort to keep the overdose patient alive. And I stress the word patient, not victim. Until emergency response teams can arrive on the scene. I have stated before, every life is precious. Every life is worth saving. We will do everything within our power to keep individuals alive with the hope that they seek rehabilitation and long-term recovery. Thank you.
Thank you.
Thank you, Jim. You can see the dedication of Jim White. I think it's so important to highlight this work between these communities and providing Narcan and making it accessible. It really demonstrates for us that gold standard of communities working together, but it takes leadership to do it, and it was Jim White who really has led this effort, and I want to really recognize him for that and for his dedication. I also now want to introduce Kelly Joseph from the Framingham Board of Health and the program coordinator from the MOPC grant, which is another model of collaboration within MetroWest. Thanks, Kelly.
I talk really loudly, so I don't want to blow anybody out of the room. Thank you, Christine, for the introduction, and thank you to the Charles River Rotary for committing time and resources to discussing the issue of opioids. I am appreciative of the invite to be here today to speak with you about some of the collaborative work that I am privileged to be a part of in the community. My time is brief, so I'm going to stick to my script, but I'd like to highlight just a couple of things for you today. First is the opioid coalition that exists in this region. Second is a little bit about what we've learned about local opioid issues and how we're looking to address it. And lastly, the benefits of collaboration. As Christine mentioned, I work at the Framingham Health Department, where I serve as the program coordinator for the Massachusetts Opioid Abuse Prevention Collaborative, also known as MOPC. Our funding comes from the Massachusetts Department of Public Health, Bureau of Substance Abuse Services. There are 19 MOPCs across the state, and the local MetroWest MOPC is a collaboration between Ashland, Framingham, Hudson, and Natick, with Framingham serving as the lead community. MOPC is focused on implementing regional systems, policy, practice, and practice change in 2 distinct areas. The first of which is to prevent opioid misuse, also known as primary prevention, and the second is to reduce the consequences associated with opioid misuse, namely overdoses and fatalities. Over the last year and a half, the MetroWest MOPC has conducted an extensive community needs assessment and subsequent strategic planning, which has helped us better understand the scope and impact of opioid misuse in this region. I could spend a considerable amount of time talking to you about what we've learned, but instead I'll focus on just 2 things. First is that opioid misuse among high schoolers is relatively low. However, there is significant use of other substances like alcohol and marijuana. As we know, the earlier that a youth experiments with substances, the greater chance they have of developing a substance use disorder later in life. So, by delaying substance use of any kind, we are in fact reducing opioid misuse. As for why young people end up using, feelings of belonging and connectedness are immensely crucial. We learned that those who report having a caring adult in their lives outside of their school environment have lower rates of substance use. To address this as a region, we have teamed up with another grant initiative and are implementing efforts to develop and expand networks of caring adults in a variety of community settings. Second thing I'd like to highlight is in line with trends across the state, white males in their 30s are still dying at the highest rates. But with the rise of synthetic opioids and street drugs, with or without the user's knowledge, the age of fatalities has begun trending down. So we're now seeing more deaths among people in their 20s. Additionally, we reviewed death records in all 4 of our communities from 2014 to 2016 and learned that individuals working in trade occupations account for a sizable portion of all opioid overdose deaths. Other MOPSI coalitions across the state have uncovered similarly concerning data. Our work in this area is to promote long-term procedural and practice change about universal precautions at agencies who have clients that are either actively using or are in some stage of recovery. Again, these are just two brief examples of some of our efforts that have begun to get underway. The final thing that I would like to speak with you about is collaboration. There is a phrase that nicely describes coalition work, and I think it's go slow and be in the know. This is generally can be slow work, but it is informed work. And the MetroWest MOPSI has spent considerable time learning about this issue locally. We're thoughtful and coordinated in our efforts, and we have resources and capacity to work together to keep people in our communities safe. As we're all too aware, and has been mentioned a number of times, opioid misuse has risen to a public health crisis, and there's no state, no community, no neighborhood that is immune to this. In order to make real impact and find sustainable solutions, our efforts also need to be regional. There are no borders. The MOPSI grant has allowed for us to build these important cross-sector connections, and in order to do this work, we have had to make change within our towns as well as across our towns. In the MetroWest in the MetroWest region, we are particularly lucky to be in an area that is not only rich in resources, but more importantly in collaborative energy. And the program that you just heard Jim speak about is a successful example of this collaborative spirit, of 4 health departments being innovative, working together, sharing resources and funding to establish systems with a regional impact. If you work at an organization or business and are thinking about ways that you can get involved or make change, my advice would be don't go it alone. Consider partnering with similar agencies so that you can have more of a collective impact, or share your inventive practice so that others can learn and follow suit. We can do work faster together, and when the issue is as important as this one, our ability to do so means lives saved. Lastly, I would encourage you to do one more thing, and that's be hopeful. Look around at the diverse representation in this room. Who we need to solve this problem are sitting right here. If we commit to using a regional approach to tackle this issue together, we can implement initiatives faster and broader and leverage our collective impact in a way that will change our communities for the better. Thank you.
Thank you, Kelly. I loved go slow and be in the know. And really, I think we can all be inspired by listening to how our different public health departments in these towns are working together collaboratively to make change. I think we can all do that. I'm going to introduce John Featherston to speak for a moment about he's now putting on another hat in his role as at the Ashland Board of Health in his work with local pharmacies.
Thank you. Real quick, they're hiding in the back of the room, but I want to acknowledge Framingham Police Chief Ken Ferguson is here today, and Representative Lewis just walked in as well. So thank you for joining us. Very important that we have representation of first responders in Framingham, so thank you, Chief, for making that part of your day. We really appreciate you being here. As a member of the Ashland Board of Health as well, and my colleague Mark Oram from the Ashland Board of Health, the director back there, I really have nothing to add that Jim and Kelly haven't already said. But a Board of Health's role is to get people to pay attention. And that's what the local boards of health have to do with the pharmacies. The pharmacies are the gateway to the opioids. And when Ashland first got Narcan in Ashland, I went to the pharmacies, and surprisingly, I got pushback from the pharmacies, saying, well, you know, we're not going to put up any signs, we're not going to do anything because, you know, we don't want the stigma, we don't want people talking about opiates inside the stores. And I was kind of shocked by it, and I was also kind of shocked by the reaction from people in the community. Why are you pushing Narcan? These people, you know, they deserve it, they're drug addicts, why are we trying to save lives? And I've been in public service for many, many years, and I was kind of really taken back by that and said, that is why we need to change the stigma of what the opiate crisis is. Because as everybody knows, the opiate crisis affects every demographic. It affects everybody in this room. So what we need to do, in my opinion, and what we're doing in Ashland, is we're working with the pharmacies. We're working collaboratively with the pharmacies to pass out information. Whenever there is an opiate prescribed in Ashland, we're asking them to pass out documents saying, you know, what are opiates? We're gonna provide this data to them. Because what better resource is there? And what better way to educate people about the opiate crisis? God forbid you have a son who broke their ankle playing soccer, and you don't have the information that we all have. But the pharmacies can present, because everybody that walks into a pharmacy, do you have any questions? No, sign right here, is a great opportunity to educate anybody on the opiate crisis. It might be your father, it might be your grandfather. And that's what I ask you all to do today as you go forward. When you go to your local pharmacies, initially the pushback is going to be, no, we're not going to do that. But everybody in this room, including the Natick Board of Health, the Hudson Board of Health, the Framingham Board of Health, and even our first responders, go back to the pharmacies, encourage the conversation. It might be slow and steady, but we have to have that conversation with our local pharmacy because that is our key. So if I could ask you guys to do that, then we're going to make some steps. Thank you for your time.
So as I said, today it's about coming together, learning, but also a call to action. And in that vein, I'd like to welcome up Katie Sugarman from the Natick Opioid Task Force and Kristen French from Decisions at Every Turn in Ashland. There is a document, like I said, in your blue folders that says, what can I do? Both as a community member, also as the medical community. And they're going to come up and talk to you about that very question, what can we do moving forward? After that, we're going to have time for if we have some more comments from our honored guests and Q&A. Like I said, we hope to get you out of here close to 9 and people can stay and speak with each other after that. So. Okay, Kristen French from Decisions at Every Turn.
First, I'd like to thank Christine for inviting me to participate in this really important conversation today. I'm usually a behind-the-scenes person, so I'm usually not up front talking. So I'll do my best. As Christine said, my name is Kristen French. I am the Director of Prevention Outreach for the town of Ashland, and I'm also the Director of Ashland's Decisions at Every Turn. We are the Substance Abuse Prevention Coalition for the town of Ashland. So prevention is the core of my work, and it's also my passion. So I'm going to spend a few minutes talking about prevention. If you've been working in any space in substance use, you've heard the conversation, prevention versus treatment. When it comes down to funding, do we fund prevention? Do we fund treatment? When you go to a conference, do we go to prevention workshops? Do we go to treatment workshops? The opiate crisis is vast, and it's large, and it's complex. And I'm here to say that it's not an either-or decision. It's a both-and. We need to be doing both. So all of the recommendations that you've heard today about intervention and support and treatment and recovery, we need to continue to do those. And it's very, very critical that you work with your community partners to do so. And it's also vital that we work on prevention efforts. And by prevention, I mean introducing prevention and programs and education before kids are 13. By introducing programs that help build resiliency and help young people make good decisions, by focusing on actions and strategies that take place before risky behaviors occur. And as Kelly said, creating connections within the community so young people feel that they're part of something bigger. And also, as Kelly addressed, it is key to continue to focus on alcohol and marijuana, because when we do that, we actually reduce the risks of addiction, which can lead to other use later on. So, the good news is there are things going on in our communities already in this area. If you talk with Katie afterwards, or Kelly, or myself, we can talk about different prevention coalitions and task force and other programs that are already happening within our communities. So what can you do? Reach out to us, talk to us, find out how you can get involved, talk with your neighbors, your friends, your colleagues, find out how you can support prevention, how you can advocate for prevention, how you can talk with people in your schools to really get the programming that can really help with our young kids. So I would love to, in closing, I would love to be able to say, next year, I'd love to be in the same room next year, 5 years, 10 years down the road, to say all of us have really taken a good step in reversing the opioid crisis. So, thank you.
morning. My name is Katie Sugarman. I'm the Prevention and Outreach Program Manager for the town of Natick and the Acting Director of the Natick Together for Youth Coalition. Kristen did a wonderful job talking about how we can build a culture of prevention in our region, and I'm going to talk a little bit about building a culture of recovery in our region, because as she said, we need to be doing both simultaneously. So one of the first things you could do after you leave here today would be to continue to educate yourself. And I think we might be sending out with the post-event email a list of some recommended reading that actually parents from SOAR Natick put together as part of National Recovery Month last year. So we will be happy to circulate that. As well as going online and finding some information on reputable sites like the Mass Organization for Addiction Recovery. If you want to know some of the policy efforts you can get involved in on a state or even national level, that is absolutely my go-to resource for what is happening and what we should be aware of. Attend educational events that are happening in our region. I know all of the communities that are represented here are doing things on a monthly, sometimes quarterly basis. Shameless plug, in Natick we have our monthly Addiction Resource Center where we have workshop topics on issues related to addiction and recovery, as well as naloxone or Narcan training at every single workshop. Our next one is coming up on Monday, April 30th at 6:30 p.m. at the Natick Community Senior Center, and the topic is actually going to be on a theme that Cheryl so articulately alluded to, which is that challenge of when does substance use become addiction. That's one of the biggest barriers to actually starting to reach out and get help, is figuring out what's kind of, quote, recreational or experimental use, and when is it actually becoming problematic use. So we will have some very brave folks in our community, a young person in recovery and his mom, who are going to be there to share their experience, as well as a treatment professional, and to field questions from the audience. A second thing you can do is to get rid of those medications you don't need at home. So go look through that medicine cabinet. First of all, really think about how you're storing those medications. If you've got young ones at home, they should not be accessible, but you never know when there could be somebody in your immediate social circles who could be struggling with substance use issues that you're not aware of. So making sure that they're not accessible to anybody who drops by your house is really important, making sure they're locked up. But you can also dispose of them in the anonymous drop boxes in all of our police departments in the region, and the DEA is hosting one of its National Take Back Days on April 28th. So between 10 a.m. and 2 p.m., drop by a police department and you can get rid of those medications then as well. Thirdly, if you are in a position of influence in a volunteer or employer capacity, really think about what you could do to change the protocols in your organization to make those spaces recovery-oriented spaces. So when I say recovery-oriented, one great example would be training your staff in overdose prevention and naloxone use. So if you're already training folks in basic CPR and first aid, consider adding the overdose prevention protocol to your training. As Jim mentioned, you now have 4 health departments that you can draw upon to go out into your organization, train your staff for free, and leave some starter kits behind. We've already done it, as Jim mentioned, for our library in Natick. We're going to be targeting local fast food restaurants, hotels and motels. We will be hitting the rec department within the next month. So consider reaching out to us, because we're a resource and we're eager to help. You can also make your space more recovery oriented by making sure people are aware of EAP services as if you offer them. We also have resource cards here that are out on the table. These are Natick, but most of the resources here are not Natick specific. Natick Rotary was kind enough to print these for us, so thank you to them for that. And I will also say that I will also just plug one of the other things Cheryl mentioned, which was creating job opportunities for people in recovery. That's a really hard step, and it's so important, because part of becoming reintegrated into society is having a way to take care of yourself, right? Those are the basic life skills that folks are learning again as they get involved in their community. So maybe looking past a Corey that doesn't quite look sterling initially, but may have some potential related to it, that with the right mentoring and supervision could really help someone jumpstart their life. they might also need some flexibility on the job too, to go and address some of the counseling or court mandated appearances they have to make. And then lastly, I'm gonna just go back to another thing that Cheryl mentioned, which was around addressing stigma. We really have to rethink some of the language that we use. Some of our national and state organizations are still slow to keep up with the evolving language. Abuse still shows up in a lot of our acronyms, and we need to get rid of it. But for instance, instead of saying substance abuse, you could say substance misuse or substance use disorder. Instead of talking about substance abusers or junkies or addicts, talk about a person with a substance use disorder. We're talking about making person-centered language the focus of our discussions. And lastly, if you know a person or a family who's struggling with addiction, reach out and let them know that you care and you're thinking of them. It can be really stigmatizing and isolating to go through this experience, and it doesn't mean you have to show up with resources and the answer, because you're not going to have it for them. But reaching out and just sending a quick text saying that you care and you're thinking about them, or asking them out for a cup of coffee just to catch up and check in and see how things are going. Follow their lead, but make sure that the door is clearly open to them. There's the saying that nobody brings you a casserole when you're dealing with addiction. It happens when you're dealing with cancer. It happens when you're dealing with other major chronic illnesses, but it doesn't happen with addiction. So be a part of that solution and that community connection. Thank you so much for your time, and I look forward to continuing to work with all of you.
Thank you, Katie, and I so grateful for all of these specific recommendations that we can all look at going forward. And there, I think all of the feedback we've gotten here is so rich. Most of it is in your folder on that what can you do or what can I do document. In addition to that, there is a sheet about in terms of the medical perspective as a patient, as a medical provider, what can be done there as well. So again, that we'll be sending them electronically as well to everybody, but that's all in your folder. Also in terms of shameless plugs in terms of what can I do. I would be remiss in not mentioning the fact that our Charles River Rotary Club, which meets here at the Hampton Inn every Thursday morning at 7:30, this is one of our areas of focus. Our areas of focus, our main areas of focus, of course, is service above self, but our topic of focus is really supporting healthy youth in our community, and one of our focuses within that is the opioid crisis. We're small, but if we can work to connect people together to do great things, we will feel really gratified to do that work. And we would love to have members join us. So that's an open invitation. Come have breakfast. We'd love to hear from you as well. So we are now at kind of the end of our formal, in terms of our presentations. I would like to welcome Q&A, and also if there's any comments from people who are our distinguished guests here who haven't spoken today. And then after that, people are welcome to stay and just get to know each other. And we have lots of resources that have been alluded to today for everybody. So I don't know if anybody up here in the audience has something else to say, or if there are any questions.
We should hear from Secretary Bennett.
Yes, that would be great.
Really good to hear from.
Well, thank you, Peter. Appreciate it. Just Representative Linsky and Gentile, Lewis, nothing happens for the governor, Baker, Lieutenant Governor Polito, unless the legislature is working with them, so thank you very much. I appreciate an opportunity to speak. This is probably the most important town to me in the Commonwealth. My father was the football coach here from 1957 to 1974 until he passed away. My mother taught me for 30 years, and I went to Cole School, where I learned to say the Pledge of Allegiance. This morning, my wife said, "Where are you going to start the day off?" And I said, I'm going to the Natick Rotary Club to replace the governor. And she said to me, "Boy, everybody's going to be disappointed this morning." Being secretary in the Commonwealth of Public Safety, you have a lot of different jobs. And those jobs have to do with the state police, which Howard Carr is making very famous, including me, the prison system, the National Guard, the medical examiner's office, and so many other different agencies. No one can go in there and be an expert. But one of the most important things when I got in there was the opioid crisis. Having been the first assistant in Worcester and an assistant district attorney in Middlesex and in Suffolk, and in private practice, I had seen a lot of terrible things in this world. I've been to 100 autopsies. I've been to 100 murder scenes. I've seen children ripped apart and their bodies torn apart. But one thing that stuck with me my whole time was a person I was representing as a defense attorney. And one time his parents said to me, can you please get our son into a program? He was going to be held on bail. I went downstairs to talk to him, and while I was talking to him, I said, your parents want you to go into a program. And he said, no, you're my lawyer, I want out of here. I don't want to be held on bail. And so I talked to him for 10, 15 minutes, and I said, yeah, okay, I'm your lawyer, I'll get you out. And I got him out of Quincy District Court. When I came back for pretrial hearing 3 weeks later, he didn't come back, he had overdosed and he had died. And that's something that has always stayed with me for the last 15 years. If I had spent a half an hour, 2 hours, maybe he would have gone into that program and not died. The governor has spent $192 million with the help of the legislature to try to fight the opioid crisis. He expects to double that investment over the next 5 years. God willing, he's in office over the next 5 years. But the next part of it that I realized was that this wasn't going to be something that we could get out of by putting people in jail, as Sheriff Katusian said. But the programs that the police have been running around the state have really made a difference. There's a program in Plymouth where everybody who goes to the hospital for an overdose, the police go to their house the next day, not to arrest them, but to ask them if they'll go in to treatment. They work with all the public sector, private sector, all the places where they can get treatment. If the person will go in and get treatment, they'll follow up with them. The police step out with District Attorney Cruz. As a result of that, we started a pilot program in New Bedford, in Lynn, in Worcester, and in Quincy. And that pilot program is every time the police make an arrest where a drug dealer is selling to a drug user, they arrest the drug dealer, but they give the drug user a choice. If you'll go into treatment, we won't arrest you. We'll keep you out of the court system. We'll get you treatment, and the district attorney's office has agreed not to charge those users as long as they don't have an extensive record. It's pilot programs like that that involve law enforcement, like you get from Chief Hicks or Chief Ferguson, that makes all the difference in the world, and it's the kind of innovative things that make a difference, and frankly, it's the kind of thing that Rotary clubs and public and private partnerships can do. Thanks very much.
Linsky or Representative Gentile would like to say a word?
Let me just talk for a minute, and maybe I just want to recognize Jack and Carmine. This is an issue that's so important to everybody in the legislature because we've all been touched in some way by this. We don't have the answers, we don't. But it's important. We're about to do the budget in a couple of weeks, and this is so important because it puts real faces on real people. Let me just talk from a personal standpoint. For anybody who knows me, they know that the real driving force of my life is my 3 sons who are now in their early 20s. And probably the most important part of everything that I did as they were growing up is I was a Natick Little League coach for about 10 years. You know, coaching kids down at the Little League fields down by the Charles River in South Natick, really, really important part of my life and their development. Over the past couple of years, I've been to funerals of 4 kids that I coached them in. And it's just something I don't want to do. So this is important stuff, and I'm very, very, very happy to be here. I will do whatever I possibly can. And I know that Jack, Carmine, Karen and Richard, we're totally committed to doing this. And that's why these types of meetings are so important, because we need to learn. We don't know what to do. We're legislators, we're lawyers, you know. So this is just really important. So I just want to thank Charles River for putting this together this morning.
Well, Christine, I want to thank you and the Rotary Club for putting this together today. I started out in this area over 30 years ago by putting together a substance use program in the Watertown Public Schools. And after that, practicing family law and criminal law, I came across these issues on pretty much a daily basis for about 30 years. And I'm very encouraged by everyone here today and all the work we're putting into it. And also I want to, if you haven't seen the Boston Globe today, I'd take a look. There's a story on the front page in the lower left about a healthcare company column that involves what we're talking about today. Involves treatment on a comprehensive basis, realizing that it's not only inpatient, it's outpatient, and it's continuing. And I was really heartened by that article. And it's one of a number of physicians or healthcare providers who have started out in their career doing something else and then come to this area. My own family, one of my cousin's son who started out as a pediatrician, and he saw this need, and now he's in addiction care. So thank you all for coming today, and together I think we'll make a big difference.
From the back, and as you, or come on up. I also, while you're coming up, I wanted to recognize we do have people from the schools here as well. We have our community coaches from Natick High School. We have members of our school board and our board of selectmen as well. So I want to recognize all of the school folks here too.
And I did want to apologize. I have 3 kids as well, and getting them out the door in the morning is a feat that I haven't quite accomplished, and anyone who's a parent probably, hopefully, can relate this morning. My 3 kids, they have their own story to share, and it's really their story, but they spent the majority of their life in foster care before I met them. And so we can only begin to imagine, myself included, what this epidemic has meant to their own lives. And as I'm now in the legislature, I think I can speak for all of my colleagues in saying we will do whatever we can from our perspective to make sure that the funding is there, the resources are there. As David said, we're just about to embark in this year's budget, and the budget is this complicated document, but it's also the embodiment of our values. And what we fund says something about who we are. What we don't fund says probably even more about who we are. And putting more funding into the opioid crisis is huge, but my colleagues aren't forgetting that the opioid crisis doesn't just touch a line item, it touches families, and it has secondary and tertiary effects as well. Whereas the opioid crisis is plaguing all of our families, the need for funding for HIV prevention is as high as ever before. The need for fully funding DCF is as high as ever before, as caseloads are growing and growing on a staff that's already stretched. And so this is something that touches every line item, it touches every family. It's surely touched my family in a very personal way, and I can speak for all of us in saying whatever we can do, just let us know. And be active citizens, residents, reach out to your elected officials. We get emails and calls from constituents on a regular basis on every aspect of the budget. Hearing from you about how important this is from you doesn't hurt. So thank you so much again, and sorry for my tardiness.
If anyone has any questions that they'd like to ask of any of I just have to say this is a room full of honored guests, so, but we welcome any questions at this point. Yeah, Paul Joseph, the president of the Chamber of Commerce, MetroWest Chamber of Commerce.
Thanks. In the vein of 2 truths and a lie, I guess it's 1 quick statement and 2 questions. So can everybody hear me okay? Sorry, just want to be clear. First of all, thank you. I've worked with a lot of people in this room, not the least of which Katie, Jim, and Chief Hicks, and folks that are working locally in Natick, and then the collaboration among the towns. Can't thank you enough. Representative Linsky talking about baseball. My son with Natick High opens the season this year because he was on in that same program. The need for men and mentors in this community is tremendous as well. So my statement is I've noticed the women that are leading these community coalitions and the need for men to mentor and model and get involved as well. Because when I've gone to some of these meetings where I see the actual work being done, it's nice to have these conversations, but it's the time in the community, it's the volunteerism that really makes a huge difference. It might not be calculable, but it really will have an impact. So I really just thank you all for the work that you're doing. In the vein of how the Chamber of Commerce can help, my ask, and I'm a relatively newly minted Rotarian. I see Lindsay here from Framingham, folks from Framingham, as well as the two Natick Rotary clubs. We need help at the Chamber. We don't have enough resources, but what I do want to commit to is promoting this issue. Mr. Fedderson's conversations with the pharmacies, we have to get that information out there. We will absolutely promote it to the extent that we can work as a group to do some targeted business community promotion, in particular with small businesses that can't be reached. They're too busy running their businesses, they have spouses, children, and the like. The more we can scale this, it's as much, if not more, about time. You're all doing such wonderful work in the legislature to get us the money. It's the commitment of effective time. So we're not grinding our gears, we've actually gotten aligned and actually move forward with that. So I will ask, and I will engage with the Rotarians in the room in particular, maybe we can put together a business-focused task force to implement the information together.
I think that's a great I was thinking, like I said, we had this meeting right here in September. Our featured speaker was Chief Hicks and the chiefs from Framingham and Ashland. And our focus was more the law enforcement response to the opioid crisis. Today we've touched on the medical community's response. Perhaps our next meeting is about the business community, and that could be something where we bring in and really target that audience of having small business and pharmacies and really partner with the chamber. So I thank you for that, and we will, you know me, we will follow up. Any other questions from? Yeah.
Thank you for putting
Paul
this
Sullivan,
together.
who is with the Newton Rotary and also works for with the Red Cross.
Thank you. Thank you all for your time and your commitment. And it's, we have a 9/11 in this country every 3 weeks. We lose that many people. Mr. Levy knows that, and appreciate your comments very much. From a legislative standpoint, we're in a state that has been more progressive, and I'll give the governor and the legislature all the credit in the world for restricting the number of pills that any physician can prescribe to 7 days. But 7 days worth of oxycodone is still 84 pills, right? There's still a lot of drugs there. Is there the other side of that is the dentist community. If you research that, right, they're kind of like one of the bigger providers. How do we? Is there legislation being discussed to further reduce the amount of opiates that a physician, especially a dentist, can prescribe to reduce the flow into the community? As we talk about that.
So I think that we're always searching, okay? Is that before us today? The answer is no, okay? If the people, some of whom are in this room, think that that's a good idea, please bring it to us. That's the bottom line.
Just did. I understand. But I want to hear from, with all due respect to you, I want to hear from people who have real expertise in the field, okay, with all due respect. Because I don't know if it's the right thing to do or not. And if it is, we'll do it. It's as simple as that,
Yes, Mr. Gardner from the District Governor for 7930.
So what I want to tell you is some really good news. In this district, Karen Gaffney's district, there's a pilot global grant from Rotary to do education prevention, which is really upstream. We really did nip some of this problem before it even begins to happen. We talked about alcohol and marijuana as other addictive drugs, and it has to be all inclusive. So that's something that's coming. You'll hear more about that in the coming months. But give you a little focus. Rotary's primary objective over the last 30 years is to eliminate, eradicate polio in the world. In 1988, we had 350,000 cases a year. Last year, we had 22. So this is something that Rotary does. 3 things I think really well is educate, so that's one reason why this global grant is based on that. Advocate, which I'll talk about in a second, and collaborate, which is what's happening now. And Rotary clubs and non-Rotary clubs are all working together as a partnership to solve this problem. But from an advocacy standpoint, I think what we need to do is come up with some core fundamental messages we just send to our legislators, not just in Massachusetts, but nationally, to see what we can do to influence the things that make sense to influence. And not advocate only at election time. Advocate year-round, day-to-day, week-to-week. And make sure that we're sending the right message globally. And if you guys in legislature can help us to craft some of that information, I think one of the action steps coming out of today might be how do we create that message and then propagate it through our community so that it's widespread. So I think that's where we go. And the second idea on the business side, this problem is inherent in every corporation that exists. All these companies are dealing with addiction, whether they are actually dealing with it or not. We need to utilize those people as partners in funding for some of the things we're trying to do locally. So please, as Rotarians, as other community leaders, reach out to community corporate sponsors and try to have them help you do what you do.
Yes, in the back.
Hi, my name is Shai Fuskin. I'm a native resident. I'm also a public health researcher in the focusing on opioids. One of my questions / suggestion, one of the strategies that we're seeing being developed, mostly here in Massachusetts, is the idea of post-overdose strategies. Most people who die of an overdose today are not dying from their first overdose. They overdose multiple times. And so it's really important when the person overdoses for the first time that beginning with the emergency department or the first responders to the community, that we really connect with these people, engage. And I really like what Sheriff said, about, he was talking about people incarcerated, but he also made the point that you shouldn't be incarcerated to get these services, that we should really follow with people up as soon as they get that first non-fatal overdose so that they can make sure to prevent the next overdose. And I don't know if maybe that's already happening or if there's any thoughts about doing that.
I think the Department of Public Health does a good job, but there's a shortage of beds for people who get treatment, inpatient treatment. There's a second fundamental way that it's done, and that's Section 35s, where people are sent to MASAC, which is a part of the Department of Corrections, and they get now the legislators' help are going to get 2 shots of Vivitrol before they're released, so they'll have an opportunity to have it locked. However, MASAC is a place where you're locked in, and that is not usually the best way for people to get treatment, that they don't have a choice on that treatment. So I think the truth is getting people with an opportunity, once they've overdosed, to have more beds is probably the best way to do it.
Anybody else have? Kelly Richardson?
I was just going to highlight, and I'm sure Katie and Jim can be available, and Chief Hicks as well, to talk offline, but that was a primary need that we determined through our assessment process, was post-overdose services and linking an individual who experiences an overdose with supports in the community to, of course, prevent future overdose, but also open up opportunities to engage in any level of recovery services. So NADIC has a model that they use. We're going to be supporting Ashland to institute something similar. Framingham has Framingham Cares and a co-responder. So yes, it's being done at the community level, and we need to do more of, but I would encourage you to talk to some of the folks in NADIC afterwards, as they have a specific model that is working well in NADIC.
Hi, I'm Amy Steinmetz, and I'm a person in long-term recovery from both alcohol and drugs. And the reason I'm standing here is because if there was an algorithm for this, a cure for this, we wouldn't be sitting here today. I also think, we're talking, a little politics and how we can make it legislatively and all that, but I also think we're forgetting about even just being really good neighbors. Someone touched on it earlier, but even simple little things, like joining maybe Pat Conway, he does that thing around Natick, like doing, they go to Blueberry Island and they pick up the booze and the leftover bottles and the needles and things like that. If we stay in our little houses and stuff like that, we're not going to be doing anything. We're not accomplishing anything. So we can make phone calls, we can do that. But if we're not even going to the common from time to time, but just sort of getting outside our little comfort zones as human beings in a community together, I think is really important. as a recovering person, and I work at Newton Wellesley Hospital, I see a lot of kids, fragile kids, smoking pot just a little too much, and we think that marijuana maintenance is okay. It's really not, but that's another issue. We think that medication-assisted treatment is okay, but it's really not, because it's still using, in one way or another. We would like to say, oh, it's great and it makes us feel good to provide those things, but really we need to be out and about as human beings in our community. That's it.
Hi, Tom Stopka. I'm a proud Natick resident, also on the faculty of the Tufts University School of Medicine, where I focus on the opioid syndemic and research related to overdose, infectious disease, substance use disorder. I had a question for Sarah Katusian, but he's gone. I wanted to comment on the importance of recognizing there's not a one-size-fits-all. I think that the continuum of all options, from medically assisted treatment to harm reduction programs to medically based, community-based programs are important. And I don't want to leave that continuum out. But I did want to ask and comment on Mr. Liebman. I was really impressed by the task force that you've developed to help to reduce opioid prescription rates and counts. Wonder if you could talk a little bit more about that, and whether you think that that's a model that you're seeing in other parts of the county, other parts of the state, and what maybe you would recommend for similar healthcare communities.
Sure. So, how much time do we have? We have an unusual situation because we have so many inpatient beds related to mental health within an acute care setting that we can respond differently and shift resources. I'm not sure you can candidly do this in certain community hospitals that haven't dedicated that much with mental health for this crisis. I will say that it does take an effort on multiple fronts. The first is to work collaboratively with the medical staff. Don't forget who writes the prescription. So if you don't work with them, you're not going to make a lot of inroads in this setting. The second is, when you do this, you also create a steeper incline in some other regulatory areas. So let me give you two, for example. We would love to notify others when someone hits our emergency room and they need help. There are certain things called HIPAA, which is a law that prevents us from doing that. So we stretch that to the limit, but a lot of people don't want to stretch it to the limit. And that's a personal choice that we make as an organization. And then the other is going to be how you respond, or resources you want to put in to solving other problems when you do this. So we are conflicted in many areas. When we reduce the amount of pain medicine we give on an inpatient basis, we get scored by Medicare. How are you rated? Okay? Are your patients more comfortable in the areas of pain management? We get a lower score than that sometimes, which affects some of our public scoring. We know that. So we won't be in the top 2%, for example, for patient satisfaction. We've made that choice. So there are multiple things at play. So I don't think it's a model that necessarily can be applied across all hospitals until there's sort of a grassroots movement about which is more important, to reduce the opioid problem or to have really good scores and publicize your patient satisfaction results, as an example. So in some areas, I think we'd be glad to share that, and I think there are ways of doing that. We'd be glad to have people come visit us, or we can talk to them over the phone, or actually work with some of our task forces that we participate in. But it really is a conscious decision that we have to rob Peter to pay Paul in some of those business and regulatory decisions.
That's one advantage the police actually have. They're not going to have a problem with HIPAA. They're just going back to visit the person that they responded to an incident to. They're not necessarily saying you overdosed. They're just going back and saying, we arrived on scene and you were passed out on the side of the street or in a particular place. Would you like to have some services for that? Would it be helpful? Here's some information. if you need help or would like help, we can get you in touch with somebody that gives treatment.
Yeah, I think you or somebody else commented on the Lowell Co-op, which is doing just that here in Middlesex County, but to the north as well. My comment for Sheriff Katujian in question was, he talked about a really good program 6 months post-release, and I wanted to ask if he had heard of the program that Sheriff Chris Donnellan in Franklin County has implemented together with Dr. Ruth Poteet, who spoke here in Natick a couple of weeks ago, which is when folks are in the House of Corrections in Franklin County, they provide medication-assisted treatment in the form of Suboxone. Right now, they have about 28 or 30 folks in the program, and Dr. Poteet works with them. It's a new model. It's maybe the only in Massachusetts, might be the only in the country. So I'm hoping that Sheriff Katujian is aware of it and might look to that model as a possibility of another piece of the care continuum.
Well,
There's three houses of correction using it now. Good. So he knows about it. It's very controversial. People generally don't get parole because they are still users. So it's a big decision to make if you are in the House of Corrections, if you are not going to get parole.
Yeah.
Well, so we're at 9:30, and I want to be conscious of everybody's time. Again, I want to thank everybody who came here today, really a room of all-stars. And I want to thank, again, I'm glad we ended with Mr. Liebman's MetroWest Medical Center's answer, because I think I'm gonna interpret kind of what he said in his response. It takes courage. It takes courage, and it takes leadership. Because to say we're not going to have the same scores from that is a courageous move. So if courage and leadership can be replicated in other hospitals, yes, these things can be done. So I want to recognize him for that answer, and I'm glad for the question. There was so much information shared today. We're going to be continuing to put people in contact with each other with all of the information. And I just want to thank you again, and thank you for being here this morning. Thank you for all of that.